Hi, my name is Mark Davis. I'm a former Papillon patient. I've travelled down today to the Royal Surrey Hospital to ask questions about how the Papillon treatment works and other questions I would have liked to have known before I had my treatment all those years ago. 13 years on, I'm cancer-free, and that's all down to the Papillon treatment. Which is why I've come down to talk about the treatment on behalf of the Bright charity, who've done an unbelievable job raising the money for this Papillon Centre at the Royal Surrey. You know, a lot more people could be helped by this treatment, and this is why I'm doing the video.
Professor Papillon was a consultant oncologist in France, and he used a localized form of radiotherapy to deliver radiation to very early rectal cancers to enable patients to have the cancer treated with radiotherapy alone and to avoid surgery, particularly to avoid surgery in either medically unfit patients or to avoid having a colostomy bag where the bowel contents come into a bag that's placed on the abdominal wall. He then taught this technique to Professor Sunny Mint, who is in Liverpool in the UK at Clatterbridge Cancer Centre. Sunny introduced this technique into the UK 25 years ago now, and he has been treating over 1,000 patients with the Papillon technique. It's gradually increasing in popularity around the country, and we now offer it currently in 4 centres around the country, in Nottingham, Hull, Liverpool and in Guildford. We in Guildford were the 3rd centre in the UK to open and offer the Papillon treatment.
I was diagnosed back in 2003. I was 31 at the time. I was told that the problem with the tumour was it's quite close to the end of the colon. So the only option I had was to have radical surgery, to have everything removed and to have a permanent stoma. I asked what the other option after that was, and they said about 12 months. So, bag, box, they were the only options I was actually given at the time. Luckily, I found out about the Papillon treatment, and that gave me plan C.
When a patient comes to me in clinic to talk about Papillon treatment, if a patient is able to have surgery, then the most important thing that I will tell somebody is that the Papillon treatment is not as effective at preventing regrowth of the cancer as surgery. Surgery is the most effective way of preventing the cancer from coming back. However, sometimes that surgery will require a permanent colostomy bag, and some patients do not want a permanent colostomy bag. And so if they will accept a treatment that has a slightly higher chance of recurrence but seems to carry the same overall survival in the large series of patients that we've looked at, then we can offer Papillon treatment. For other patients who can't have surgery, then the Papillon treatment is a more effective treatment than radiotherapy alone at preventing them from needing a colostomy bag or having complications from the cancer later.
The gold standard is surgery, but what they don't concentrate on is the consequences of the treatment. So if you're younger, you're going to live with the consequences for longer. And that's what the surgeons didn't take into account at the time. Yes, they were trying to save my life, but not my quality of life. Papillon offered me both to save my life and my quality of life, and so the consequences of that decision then I'm living with. I'm 13 years cancer-free, so yeah, I'm quite glad I made the decision.
I think the most important thing about the Papillon treatment is that it offers patient choice. This is what the patients have been most grateful to me for when they've been offered Papillon treatment. Some patients will still choose surgery when offered Papillon treatment, but at least somebody has listened to them and given them a choice and given them an option of what treatment that they can have. When a patient comes to me to discuss the treatment, I'll explain that we give them a specialised diet for 3 days before the Papillon treatment. This is a low-fibre diet and may constipate them a little bit, but it makes it easier for us to give the treatment to them. When they finish the Papillon treatment, they can have quite normal diet after that, and then for 3 days before the next treatment, they'll go back on the low-fibre diet. They will see the radiographer for a chat first, and then they will have an enema which will clear out the bottom of their bowel and make them go to the toilet.
Hi Mark, my name's Kierna. I'm one of the radiographers here.
Hello.
I'm just going to do a quick chat today about what we're going to do,
Okay.
explain about the procedure and the enemas. So what I'm going to do in a minute is get you to get changed into these lovely Dignity shorts.
Dignity shorts,
Yeah.
okay.
So they're one size fits all,
Okay, good.
that's why they look quite big. And then we've got this hole at the back, and that's for ease of access.
Okay, excellent.
What we'll do is get you to put a dressing gown on as well,
Okay,
obviously to cover the hole. And then we'll bring you into our procedure room.
okay.
When you come into our procedure room, we've got a couch all set up for you. It's got a blue headrest for you,
Okay.
and that's for your face to go into when you're
Uh-huh.
lying down. And it's got a abdomen support, which just goes under your pelvis to help keep your bottom up.
Okay, so you're going to be kneeling.
Yes, so you'll be going
Okay.
on your front, yeah.
Yeah.
And we've got some foot supports to help keep your feet in the right position as
Okay.
well. What I need to do now is give you some enemas.
Okay.
So we give you 2 little micro enemas, and that's just to clear out anything that's left in the bowel.
Okay.
Just makes it easier for the doctor to see what
See
she
the
needs to
tumour.
see.
Right, yeah.
And that way there's nothing getting in the way of us treating as well.
Okay.
And what we also give is a little bit of rectogesic, which is a muscle relaxant, and that just goes on the outside of your rectum, and that just helps to relax your muscles so that you're not squeezing against the tube.
Yeah, I'm a bit tense, I have to admit. Okay, no worries.
So this is the room which we do the Papillon treatment in.
Okay.
This is the Papillon machine.
Okay.
This is the bed which we do the Papillon treatment in. At the moment, this is set up for patients who have the treatment given to them when they're kneeling down, bottom in the air, leaning their head downwards. We
Okay.
also sometimes use these comfortable stirrups, particularly for elderly patients who are a little bit more immobile. And those stirrups will go on the side of the bed, and they'll rest their legs in the stirrups whilst lying on their back. When you come into the room, you'll have your doctor in the room,
Yeah.
and perhaps another doctor helping them as well.
Right, okay.
Then we also try and have our clinical nurse specialist there to support you. They'll usually be by your head, talking to you, often talking about things completely unrelated
yeah,
to
yeah.
this.
Just taking your
Really
mind
trying to
off
take your
things.
mind off
Yeah,
things.
yeah.
And we've found so many interesting different stories about our patients as we're doing that. But it really does relax the bottom
Yes.
to actually talk and laugh during the treatment. So we will be trying to sort of talk to you about
Yes.
quite different things.
Okay.
And then some of our radiographers will be in the room, between 2 and 3 radiographers,
Okay.
to use the machine and also to help me get the applicator and get everything into the right
positioning
position.
and all that sort of stuff.
Yeah.
So
So it's quite a busy room.
5 or 6 people plus yourself in sort
Exactly.
of
I will examine patients very gently with my finger to check where the tumour is. I'll then examine them with a small plastic scope called a sigmoidoscope, which allows me to define exactly where the tumour is. I'll then put the Papillon applicator in. This is a little bit uncomfortable as it goes in, and for some patients we can offer gas and air if they have discomfort, and very occasionally we'll give patients very light sedation or anaesthetic if they require it, but the majority of patients don't need that. We'll use the treatment applicator, and I've got one of them over here.
Right.
So this is a sterile one, nice and clean.
Yeah.
And it looks a little bit scary. It's actually only roughly the size of a large stool,
Yeah,
so
so-
it is the size of something that would naturally come out of the bottom.
Yeah, it's no bigger than a Smarty tube or something like that.
That's right, that's
Okay.
right. Once we
In-
have the
in the rectum.
applicator, we actually have a clamp that attaches to the side of the bed here.
Oh, okay, right.
So this clamp attaches in place,
Yeah.
and we place the applicator. Once the applicator's inside the patient, we've tightened that on and tighten that up there.
Okay.
So that clamp will hold the applicator inside the patient. We can see the tumour by looking directly down. We can also use a little camera here, and we put the camera on the end and we can take a picture, and then the picture will come up on the screen here to show us the cancer. So this is somebody's cancer as it's just being treated. And this is the cancer here, and you can see the nasty, angry cancer there. And there's the normal piece of bowel around the cancer. And we can take a picture before and after the treatment to see where the cancer is, to check that we've given the cancer the right treatment. And then we can also see what the cancer looks like as the treatment is going on.
So the applicator, really looking at this, only covers the cancer, so it's only really killing the cancer cells.
That's right. Very, very localised, which is why some patients will also need external radiotherapy to kill anything that's a little bit deeper or around it.
Okay, great. So you can see in real time that the tube is going to go directly over the cancer itself, and from there on in, you use this thing.
That's right.
It's really quite kind to the rest of the colon, which is important because chemo and external beam can be quite taxing. But it's a choice you've got to make. And I think it's a conversation you've got to have with your doctor. You're going to have side effects from radical surgery, having a soma. You are going to have side effects from radiotherapy and chemo.
We have the treatment machine here. And this machine makes x-rays that come out of the tip of the machine. And then very carefully, holding it, usually with a couple of people here, holding it into place. And then the machine is in the place. And then that balances, and then the treatment would be given probably over about 90 seconds to 2 minutes. And then at the end of treatment, somebody carefully holding that in place.
This is why we have radiographers.
Exactly. The treatment machine is taken away. And then we take a picture again, and then we'll carefully unclamp this and remove the applicator from the patient.
And the patient breathes. So that entire thing takes about 10 minutes then?
So that takes approximately 10 minutes for that part of the treatment. So about 20 minutes in all.
And they can go home more or less immediately?
So they sit down, we offer them a glass of water, let the blood come back to their heads, particularly if they've been in their head down position. And then on the last day, we'll take them through the pictures, and we'll show them the pictures that they've had from the first treatment to the last treatment, how nicely the cancer has been shrinking with each subsequent treatment.
So they can actually see the cancer shrink almost in front of their eyes?
Yes, which is really nice.
Be a weird set of baby pictures of your tumour just dying. Great. How many treatments would a normal patient have?
So most patients will have 3 treatments. Some patients will have 4 treatments. That will all depend on what kind of treatment they've had before, or whether they're having external beam radiotherapy afterwards, and what kind of cancer it is, the individual nature of the cancer. It's very personalised treatment.
So depending on the individual, where the cancer is, you're going to individually do a treatment regime that's best for them.
Customised for each individual patient, but it's usually between 3 and 4 treatments. After the treatment, there can be a little bit of spasm of the bowels. Sometimes there's a little bit of localised bleeding, particularly if a patient takes tablets such as warfarin or aspirin. But mostly the patients are comfortable through that. Some patients in that time in between treatments need some steroids which are given into the bottom, and some patients need mild painkillers. In the long term after treatment, there is an incidence of bleeding after the treatment. Sometimes that needs treatment with something called argon plasma coagulation, which is a treatment that's given when the patient has a scope test into the bottom and it decreases bleeding. And the bleeding is very amenable to treatment with that and decreases quite quickly. It's not uncommon for people to get a small ulcer at the site of treatment, which is usually quite painless and lasts from about 3 months to 12 months after treatment before it then disappears and forms a scar. We keep a very close eye on patients after treatment. We do a scope test and an MRI scan every 3 months for the first 2 years, and then 6 monthly during year 3.
I was invited down by the Bright charity to help give some more information about the Papillon treatment that I received all those years ago. The Bright charity has done an unbelievable job bringing the Papillon treatment to the Royal Surrey, and with their help and the help of the doctors, hopefully we can give more patients with colorectal cancer this great option. When I had the treatment, I didn't know what it was, would it work, or what the side effects would be, and I'm hoping we've kind of covered all those things in this film. 13 years on, I'm still cancer-free, so I'm really happy with the option, and I hope this film helps you with your journey. Good luck.